Hey there, and welcome. Today we're going to tackle a really important topic, type 2 diabetes. We're going to walk through it together, using the CCCHS Care Guide to demystify what can feel like a pretty complex condition and break it down into simple, understandable pieces. But first, let me ask you something. What if you had a pretty serious health condition and you didn't even know it? Seriously, think about that. Something major could be going on inside your body, but from the outside, you feel totally fine. Now, that might sound a little dramatic, but for millions of people, that's the exact reality of living with type 2 diabetes. It's often called a silent condition for a reason, and that's exactly why we need to talk about it and really understand it. Okay, so let's dive right in. First things first, what is type 2 diabetes? And, why is it this silent condition that can sneak up on you? Here's a simple way to think about it. Imagine insulin is a key. Its whole job is to unlock the doors to your body's cells so that sugar, or glucose, can get inside and give you energy. With type 2 diabetes, it's like the locks on those doors get all rusty and sticky. The key doesn't work right anymore, so the sugar can't get in. And where does it go? It just builds up in your blood. And here's the really critical part that the CCHCS guide points out. Most people have zero symptoms at first. Things you might think of as classic signs, like being super thirsty or having blurry vision. They tend to creep up so slowly that people only connect the dots looking back, after they've had a blood test. And that's exactly why getting screened is so important. So who should be thinking about this? Well, the guidelines lay out some pretty clear risk factors. Just take a look at this list. We're talking about things like your age, if diabetes runs in your family, your weight, and how active you are, but it's also things you might not immediately connect with, like high blood pressure or if you've had gestational diabetes. If you're nodding along to a few of these, it's for sure something to keep on your radar. Okay, so if you can't feel it, how in the world do doctors find it? Well, it all comes down to getting your numbers. Right. So a diagnosis isn't just a guess. It's based on solid data from a couple of simple blood tests. This chart lays it out perfectly. You can see these really clear lines that separate what's considered normal, what falls into the pre-diabetes category, and then what counts as a full diabetes diagnosis. It's all based on your A1C or your fasting glucose. Let's zoom in on this one number right here, 6.5%. If your A1C test comes back at 6.5% or higher, that's the magic number that signals a diabetes diagnosis. And what's so cool about the A1C test is that it's not just a snapshot of one single moment. It's like a highlight reel of your average blood sugar over the last 3 months. Pretty powerful. So let's say a diagnosis is made. What happens next? The whole game shifts to managing it. And you know what? The most powerful tools in your toolkit are often the things you have control over every single day. Lifestyle really is medicine here. And it all starts with what's on your plate. Food is huge. What you eat directly and pretty much immediately affects your blood sugar. This isn't just a vague eat healthy suggestion. A balanced diet is literally a core part of the treatment. And the other half of that equation, getting moving. Regular physical activity is the other side of the coin. When you exercise, you're basically helping your body use its own insulin way more effectively. Remember that rusty lock analogy? Exercise helps clean it up, so the key works better, and your cells can finally get that fuel they need. So what's the goal? Here's the official word on it. And look, they're not asking you to go run a marathon. It's all about building a consistent habit that you can actually stick with. We're talking something as simple as a nice, brisk 30-minute walk, maybe 5 times a week. Totally doable, right? Now, for a lot of people, those lifestyle changes are the foundation, but they're not the whole story. Sometimes medication is needed to give your body some extra support, and it helps to understand how doctors think about this. There's a really logical path they follow. Yeah, this isn't just some random list of medications. There's a method to it. The journey almost always begins with step 1, Metformin. It's the go-to, tried-and-true starting point. Then, if you need a little more help, doctors move to step 2, adding in some of these newer, modern helpers. And only when it's really necessary do they move to step 3, which is insulin. So, why that order? Well, metformin is that reliable first step because it works by telling your liver to just chill out and not produce so much extra sugar. But these newer drugs, the GLP-1s and SGLT2s, they are absolute game changers. They do more than just lower your sugar. They can help with weight loss and, this is huge, they've been shown to actually protect your heart and your kidneys. And that brings us to a really important point. Managing type 2 diabetes is about way more than just one number on a lab report. It's not just about your A1C. It's about looking at the whole picture and protecting your entire body from potential long-term issues. Take blood pressure, for instance. This number, it's every bit as important as your A1C. The guidelines are crystal clear. Getting that blood pressure under 130/80 is a massive step in lowering your risk for a heart attack or a stroke. And what you're looking at here, this is something called a monofilament test. It looks simple, and it is. It's a completely painless way to check for any nerve damage in your feet, which is called neuropathy. Finding this stuff early is absolutely crucial for preventing some really serious problems, like foot ulcers. And this checklist really drives home what good diabetes care looks like. It's a team sport, a partnership between you and your healthcare team. Of course, you've got the A1C tests, but it's also about checking your blood pressure every time and getting those annual foot exams, eye exams, dental checks, even your cholesterol. It's truly about managing your total, whole body health. Which brings us to the last and maybe the most important part of this whole journey. You've got doctors and nurses on your team, for sure. But the captain of that team, the person with the most control, that's you. This quote is pulled straight from the patient guide, and I love it because it's so simple but so powerful. Check your feet every day. It's a tiny 2-second action you can take every single day that gives you the power to spot a problem before it becomes a huge one. So we've covered a lot. The what, the why, the how of type 2 diabetes. And now that knowledge belongs to you. The only question left is, what's your next step going to be? Maybe it's finally making that call to schedule a screening. Or maybe it's just deciding to go for a walk when this is over. Heck, maybe it's just remembering to check your feet tonight. Whatever it is, no matter how small it seems, that next step is all yours to take.